Hello, nursing students, and welcome back to Nurses Courses Getting It Right Every Time. Today, we're covering IV fluids and fluid shifts. You'll learn the difference between hypertonic, hypotonic, and isotonic solutions, and you will remember the key rule. Salt attracts water, and water follows salt. Your cells are basically tiny fish tanks trying to survive. Keeping the inside of the cells stable is a tricky balance. This balance is called homeostasis. To see how water goes to different places in the body, called fluid shift, let's look at a cucumber. What happens when we sprinkle a little salt on a cucumber? The water inside the cucumber begins to flow towards salt, and we see droplets of water forming on the surface. We call this process osmosis. Remember, salt attracts water and water follows salt. This is true not only in cucumbers. Same thing happens if you administer salty fluid to the patient. We call those hypertonic solutions. They have higher tonicity than the body. Simply speaking, they are saltier than the body. For example, 3% saline. Water that is inside the cells of the body will follow that salt that is now in the veins. That is why hypertonic fluids pull water from the tissues and cells into the bloodstream, helping increase blood volume and blood pressure. Let's practice a nursing test question. A nurse is caring for a patient with severe symptomatic hyponatremia and cerebral edema. The provider prescribes 3% saline. Which assessment finding indicates that the therapy is having the desired effect? A. Increased swelling and decreased blood pressure. B. Improved level of consciousness and increased blood pressure. C. Dry mucous membranes and decreased urine output. D. Increased edema and crackles in the lungs. You can pause the video and think for a moment. Correct answer is B. Improved level of consciousness and increased blood pressure. Hypertonic solutions have higher concentration of solutes, like salt or sugar, than the fluid inside a cell. Through osmosis, they pull water out of swollen cells and into the bloodstream. In a patient with cerebral edema, this decreases brain swelling and increases intravascular volume, resulting in improved neurologic status and blood pressure. Fluids that have lower tonicity than the body, such as fluids that are less salty than the body, are called hypotonic. For example, 0.45% sodium chloride. Because there is less salt in the bloodstream, water leaves the blood vessels and moves into the cells. Cells in this case are saltier, and remember, water follows salt. Hypotonic fluids push water from the bloodstream into the cells. This helps rehydrate cells that have become dehydrated. Let's try another test question to test your knowledge. A dehydrated patient with diabetic ketoacidosis has been receiving treatment and is now prescribed a hypotonic solution of 0.45% sodium chloride. Which assessment finding indicates that the prescribed fluid is producing the desired effect? A. Distended neck veins and increasing blood pressure. B. Crackles in the lungs and peripheral edema. C. Improved skin, turgor, and moist mucous membranes. Or D. Increasing confusion and decreasing urine output. You can pause the video and take a moment to think. Correct answer, C. Improved skin turgor and moist mucous membranes. Remember, hypotonic fluids are less concentrated than plasma and move water from the bloodstream into the cells. They are used to rehydrate dehydrated cells. Improved skin turgor and moist mucous membranes indicate restoration of cellular hydration. What happens if there is the same amount of salt inside and outside? Nothing happens. There is no movement of water in either direction. The same thing happens when we administer isotonic fluids. They have the same concentration as body fluids. For example, 0.9% sodium chloride, also known as normal saline, or another commonly administered isotonic fluid is called lactated ringers. Because the concentration is the same inside and outside the cells, there is no significant fluid shift. Isotonic fluids stay primarily in the bloodstream, making them ideal for treating dehydration and low blood pressure without causing cells to shrink or swell. Now let's practice with our third scenario to see how you do. A patient arrives in the emergency department after losing a large amount of blood, following a motor vehicle accident. The nurse anticipates administering 0.9% normal saline. Which finding would best indicate that the treatment is effective? A. Cells become swollen and serum sodium decreases. B. Water shifts from the cells into the bloodstream. C. Blood pressure improves and heart rate decreases toward normal. D. The patient develops pulmonary edema and jugular vein distension. Take a moment to think. And the correct answer is C. Blood pressure improves and heart rate decreases toward normal. Remember, isotonic solutions have the same concentration as plasma and do not cause major fluid shifts. They remain primarily in vascular space and are used to treat hypovolemia and dehydration. Improvement in blood pressure and heart rate indicates restoration of circulating volume. Let's review one last time. Hypertonic solutions pull water out of the cells and into the bloodstream. Hypotonic solutions push water out of the bloodstream and into the cells. And isotonic solutions cause no major fluid shift because they have the same concentration as body fluids. And remember the secret to understanding all of this. Salt attracts water. Water follows salt, that's osmosis. And the final practice question. A nurse is caring for 4 patients. Which patient would the nurse question the prescription for? A. A patient with cerebral edema receiving 3% saline. B. A patient with hypovolemia receiving lactated Ringer's solution. C. A patient with cellular dehydration receiving 0.45% sodium chloride. Or D. A patient with increased intracranial pressure receiving 0.45% sodium chloride. You can pause the video and think for a moment. And the correct answer is D. The nurse should question a prescription for a patient with increased intracranial pressure receiving 0.45% sodium chloride, because 0.45% sodium chloride is a hypotonic fluid. And as you just learned, hypotonic fluids move water into cells. In a patient with increased intracranial pressure, moving water into brain cells would worsen cerebral edema and could lead to further neurologic deterioration. Hypotonic solutions are preferred in this case because they pull water out of swollen cells. And until next time on Nurses Courses, keep studying, keep caring, and keep getting it right every time.